Yeah, I'm gonna put away my bicycle after today. And one of the reasons is it's not safe, right? And then when you give a complaint so that they can, crack down on the drivers that are unsafe around bicycles is they don't do anything or follow up. And it's not really hard police work, right? It's simple law enforcement work, except that, this is a training detachment that shouldn't be enlisted as a training detachment. Now, I'm going to get a call from a virtual clinic, and I'm wondering things to say. Like, for example, if he says, can I help you with anything? Well, anything else? Because when they booked the appointment for my shoulder, I thought, okay, they found something wrong with my shoulder. And then I go see, and the report that I see, anyways, on Healthy Life is nothing was seen. So I don't know, is he going to refer me to other things? And I'll wait, because when I'm reading the notes, all the doctors say I interrupt him. And this guy, it's the same guy calling, he talks a lot. And they're so happy to give explanations, right? And they don't ask, like, if I know something, if I need the explanation. They take up a lot of the time, and I'm trying to maximize the time for the patient, with questions or things, because then they'll say, oh, we ran out of time. And it's the guy, I read the guy's notes, and he said, that's fine by me if he doesn't want to get me again. And the thing is that guy can't reference patients or others. Like, he can't reference that he spent a lot of time talking about what he wanted to talk about, which I didn't need him to, and I already had those explanations, or I already understood those things. And by the time you get to something you need a doctor for, you got to make another appointment. And the guy, like record the conversations. Every conversation with me, record it, virtual clinic, and learn from it. And stop saying I interrupt without saying, hey, what was the reason you interrupted? Nobody says that. And people write, oh, he's not happy with the services. But nobody writes that they're curious about why I say that. Nobody cares, right? It's so insane. So if this guy says, is there anything I can help you with? I have to say, well, yes, but, I don't believe you're trained for it. It'll be insulting, but it fits the data of the years and years, right? For example, how about not prescribing me so many medicines, right? And, working on the issues, okay? So if you don't just admit in BC or Canada, or we don't have a doctor that specializes in gut microbiome within the public system, and we're not motivated to have any. Just say that, because, the blood pressure is most certainly affected by, a chronic inflammation from food, any kind of food almost. Now, if we don't have specialists that want to do either as doctors, it could be on the phone, but it's got to be the same one, and he's got to do the problem-solving diagnosis kind of procedures where you eliminate things, right? And he can start from scratch if he wants, as long as most of the tests are around here. Even if the samples are sent far away, it takes time. Look into solving things instead of medicating things, because for me, one of the things that lowers my quality of life is interacting with people that are working for the medical profession, because all they want to do is solve one tiny thing at a time. They don't want to look at the big picture of the person. And they, okay, so here's another thing. He might say, what else can I help you with? And if I say other things that relate to it being impossible, because they say, oh yeah, we have limits because of virtual clinic. But everybody's notes are like a copy paste thing that says, but I've, recommended go to emergency room for whatever, It's like, my God, you guys don't even care. It's got to be the doctors that don't care are doing virtual clinic, and the doctors that care are doing patients in person, because there's a correlation. Now, of course, new doctors don't know this, and the ones that think they're helping, right? And they are in a way, because, people calling virtual clinic, they got nobody else sometimes. And they're sometimes far away from hospitals. But the thing is you got to make it more efficient. For example, get commitments from doctors. Say, I will sign a 10-year contract that I'll be on virtual clinic, and I'll stick with the same patients, and I'll make sure I have, at least 40% of my time available if I'm doing other things. And then you get the same person. And then you read your own notes. And then let them do their own notes somewhere in a safe way, that they're not just doing the virtual clinic kind of, Do you know how many pages in the 89, I think, is the same thing that I got in the notes, but just because it was CC'd somewhere. And when I ask for something to be CC'd to doctors, it's not getting done. And the guy, Dr. Bai, come on, like investigate my complaints. My complaints is it was so ridiculous the way he was evaluating me. And I'm like, oh my God, this guy's got like such low IQ or developmental disabilities. And why do I say this? Because he's near the end of his career and he doesn't realize how outdated and dumb what he's doing is to supposedly be an internist or specialist. It's like, my God, these guys are not necessarily smarter than me. They're just going through the motions like automatons to collect paychecks and then their pension. It's not patient-centered, this nonsense. Now, this is measurable. So that means whoever gives licenses to doctors, ask, are you okay if we kind of evaluate your specialty? And sometimes we'll send people and they'll report and or we'll observe or whatever. And they're too dumb to suddenly become competent by doing research. They're going to do the same thing and you're going to say, wow, I don't see how you deserve a higher salary than, somebody working at McDonald's, because that's lame. Same thing, the latest doctor that was checking things like reflexes or strength of certain things, the way she was doing it is like, it's like, secondary 3-level, intelligence. And I'm tired of being under their power and authority. It's like Trump. He might be very powerful, but everybody knows how dumb and developmentally challenged he is. And it's not like he's worse than the norm, as he's close to the norm. And you don't want people like that in those roles. You want to pick from people that are above the norm of intelligence and competence and pursue quality in their lives in these professions. And of course, these professions would then be severely, not underrepresented, because there'd be like hardly anybody competent enough to really be doctors if we want to use sentience and sapience as a way to evaluate them. So for me, digestion things has caused issues in my life that became mental illnesses, but that's the root. It's real. Other than my grandfather dying, which was a life event that created a depression, that I turned to my advantage. Right, I turned to my advantage. I became a better man from it, and then the digestion, the fatigue, the lack of concentration, and I think it's all linked to issues with digestion. If nobody wants to tackle this, you've got to admit it. Martin, you gotta move to another country. We realize we're just treating the symptoms or side effects. We're not competent enough as a medical industry full of systemic issues to kind of help you in a way that we should be able to if we are who we claim we are. If we are not just selling the image that we're these great professionals and this is an expert in this or this. My God, review the conversation of the gastro specialist that called me. And he thinks it's great what he did to refer me to kidney because nobody else did it from my blood test. But the thing is I was looking for a specialist of gastro digestion things, and I was going to be willing to work for years with him, even from far away. But the thing is case open, close, and I'm so brilliant that now I referred him about the kidneys. But what if the kidney is overworked, or the liver, or the pancreas? What about my recent blood test results that shows there's high levels of fats in my blood? Like when you see this, you go to the next part of the diagnosis, problem solving. But who's doing it? Like, I could have my own doctor here and they wouldn't be able to do it even if my file is only there. Like, what if I ask them, hey, what do I do if I detect dishonesties in the medical practitioner that I was offered here, in her notes, and what actually was in the letter that she sent me, which doesn't match her notes? Like, do I report it to the College of Physicians and Surgeons who just protect their own? Like, they're just gonna say, oh, it just happened this way. This is unethical behaviors, and this is something that people should go back on probation to keep their licenses for, like, So again, I would say, well, what are you trained in? Like, are you trained in problem solving and cultural repair? Are you trained in being patient centered? Are you trained in this and that? Because if they say, what else can I help you with? And I'm going to say, I have no idea what you're qualified to do. And then they all want to say, well, I'm a licensed doctor. I could pretty much, explain a whole bunch of things to you and send your referral or medicines. I mean, it's not going to problem solve anything because we need to look at you like a whole patient. He's not going to be able to say that. Or we need to focus on being patient-centered and not just maximizing the efficiency of our time online or in person that suits us and not the patient. Again, even if we reduce how many people don't have doctors, but the doctors don't spend enough time and don't have the listening skills or the ability to reference others. And I hear on the radio that more general practitioners are doing counseling or mental health treatments when they're no more trained for it as a general rule than people that work in that industry. Like, how screwed are we to just not have the conversations and about how many pathologies are within the medical professions and their associations or schools or licenses, board or whatever it is, or administrative parts, and they're elites, and they'll do entire careers. Like, you can review certain things, let's say from psychiatrists' reviews online, and you see, oh my God, there's a lot of different people that say this about that doctor. That should be investigated. So why isn't it investigated? Why is there no proof? And why are people that are supposed to investigate doctors don't want to do it? Because they'll lose doctors. Now, if you're afraid to lose doctors that really should be investigated, then those people are not patient-centered either. Now, that means every year you will go backwards in what you think is medical care.